Hello and welcome to Pace Hospital's podcast. Today, we are focusing on a critical and life impacting health topic, that is stomach cancer. Stomach cancer, also known as gastric cancer, often develops silently with symptoms appearing only in advanced stages. This makes awareness, early detection, and timely treatment extremely important. Joining us today is Dr. Suresh Kumar, a highly experienced surgical gastroenterologist and laparoscopic surgeon. With his expertise in stomach cancers, Dr. Suresh will guide us through this important topic and discuss what stomach cancer is and how it develops, early symptoms and key risk factors, diagnostic tests and cancer staging, treatment options including surgery, chemotherapy and radiation therapy, life after treatment and preventive measures. Dr. Suresh Kumar, thank you for joining us at Pace Hospital's High-Tech City.
Hi, I'm Dr. Suresh, surgical gastroenterologist and laparoscopic surgeon at Pace Hospital, High-Tech City.
Let's start by understanding what is stomach cancer.
Any cancer or tumor that is arising from the part of the intestine that is between the esophagus and the duodenum, it is called as stomach cancer.
Dr. Suresh Kumar, what are the stages of stomach cancer?
So, briefly, there are 4 stages of stomach cancer. Stage 1 is tumor which is confined to the part of the stomach. Stage 2 is tumor that is confined to the part of the stomach or it extends to few number of lymph nodes. Lymph nodes are the draining stations that are placed in the vicinity of the stomach. Stage 3 is the tumor that is located deep within the wall of the stomach and is spread to the significant number of lymph nodes in the vicinity of the stomach. Stage 4 is the tumor that has spread to an organ that is placed far away from the stomach.
So, doctor, what are the risk factors of stomach cancer?
So, like any other cancer, there are various risk factors for gastric cancer or stomach cancer. Most notable ones are related to lifestyle, that is obesity, alcohol intake, tobacco addiction, and apart from this, there are certain other risk factors that as H. pylori infection, hereditary or genetic causes, or in certain conditions like GERD, that is reflux, gastric reflux. These patients are also at risk of developing gastric cancer more when compared to general population.
Could you explain what are the symptoms of stomach cancer?
The early symptoms of stomach cancer are mainly loss of appetite, that is, patient no longer feels hunger, and sudden unexplained weight loss, that is, for no reason the patient starts seeing that his weight is getting decreased. Third is the early satiety, that is, the patient feels fullness after taking small amount of food, that he usually notices that he takes lesser amount of food than usual. Apart from this, he notices the color in the stools or any unexplained fatigueness.
Dr. Suresh Kumar, how is stomach cancer diagnosed?
Stomach cancer can be easily diagnosed with what is called as upper GI endoscopy. Once the disease is diagnosed, the patient is subjected to staging, in which he undergoes CECT or PET-CT of the abdomen. CECT is nothing but contrast enhanced CT scan of the abdomen.
So, doctor, what is the treatment for stomach cancer?
Once diagnosed and after staging, there are various options available for treating these patients. In very early cases, these patients can be treated with endoscopy itself. But most of the patients will be diagnosed in locally advanced or advanced stages, in which patient needs to undergo a surgery apart from adjuvant or neoadjuvant chemotherapy. Neoadjuvant chemotherapy is nothing but the chemotherapy drugs are administered prior to surgery.
Can you explain how to prevent stomach cancer?
As discussed in the previous question, there are certain risk factors for stomach cancer or gastric cancer. When these risk factors are addressed, it is nothing but taking precautions to prevent gastric cancer. The notable precautions or notable measures to decrease the risk of gastric cancer include lifestyle changes, which include taking healthy food, that is fresh vegetables, fresh fruits and green vegetables, and avoiding salted food made from processed wheat, etc. Apart from this, we should also quit smoking, limit alcohol intake, and also focus on weight reductions. These are all notable risk factors for stomach cancer.
Is stomach cancer curable?
Yeah, when diagnosed in an early stage, this cancer can be cured. But like any other cancer related to the GI tract, these gastric cancer are also prognosed in terms of 5-year survival. That is, number of years the patient is expected to survive when treated in a proper way.
Dr. Suresh Kumar, is stomach cancer hereditary?
Yes, there are certain conditions in which these gastric cancers can be seen inherited or which run in family. Although this constitutes a very minuscule or tiny percentage when compared to the general population or general patients that are diagnosed with stomach cancer.
So, doctor, is stomach cancer life-threatening?
Yes, in cases where the disease is diagnosed and treatment is not given timely, this disease can pose life threat.
Could you explain how effective is immunotherapy for stomach cancer?
So immunotherapy, unlike a conventional chemotherapy, boosts the body's own immune response to work against the cancer cells. Studies have shown that the recently available immunotherapy drugs increase the survival in these patients with gastric or stomach cancer.
Dr. Suresh Kumar, what is the survival rate for stomach cancer?
Like any other cancer, the survival rate of stomach cancer is also dependent on the stage of the disease, and also for survival is dictated in terms of 5-year survival. That is, the percentage of patients live for 5 years from the date of diagnosis. In early stages or disease localized to the stomach, the 5-year survival will range from 50 to 70%. In disease that is localized to the stomach and has spread to the nearby lymph nodes or nearby organ, the survival can be as low as 25 to 35%. But when at the time of diagnosis the disease has already spread to distant organ, that is organ far away from the stomach, the survival can be as low as 5 to 10%.
Can stomach polyps be cancerous?
Yes, stomach cancer can present as a polyp or an ulcer at the time of diagnosis, and also there are certain polyps that can transform itself into malignancy in certain time. These polyps are called as pre-malignant polyps. Most notable one is the adenomatous polyp.
So, doctor, can smoking and chewing tobacco cause stomach cancer?
Yes, smoking and tobacco chewing is considered to be an important risk factor for stomach cancer. Because of its direct carcinogen property, it can also lead to DNA damage and increased acid production, which can lead to gastric cancers.
Dr. Suresh Kumar, what can the last stage of stomach cancer be cured?
So it is better to put this question in a different way. Is there any possible way we can treat patients with last stage gastric cancer or stage 4 gastric cancer? Technically, there is no way we can cure gastric cancer in stage 4 disease or last stage gastric cancer, but we can increase the longevity by subjecting him to certain therapy methods, which include immunotherapy or targeted therapies.
Can you explain, does red meat increase the risk of stomach cancer?
To a certain extent, especially red meat consumption can increase the risk of gastric cancer. Apart from the red meat consumption, processed meat consumption can also increase the risk for gastric cancer.
So, doctor, are stomach ulcers cancerous?
Yes, in certain conditions, this gastric cancer can be cancerous, and also a benign looking gastric ulcer can turn into a malignant gastric ulcer after certain duration.
Dr. Suresh Kumar, one final question. Does alcohol cause stomach cancer?
Yes, alcohol consumption is also considered to be an important risk factor for stomach cancer through its direct carcinogen property and also property to induce inflammation within the gastric mucosa, leading to chronic gastritis, which in turn leads to gastric cancer. Apart from this, the acetaldehyde, which is a byproduct of metabolism of alcohol, can also have carcinogen effect within the body.
Thank you, Dr. Suresh Kumar, for sharing important insights on stomach cancer with our listeners. We hope this discussion has helped patients and caregivers better understand stomach cancer, its early signs, treatment options, and the importance of timely medical care. Your health is a priority, and early detection combined with the right treatment can significantly improve outcomes and quality of life. If you or someone you know have concerns related to stomach cancer, please don't hesitate to consult a gastroenterologist or oncologist. Expert guidance, accurate diagnosis, and personalized treatment play a crucial role in effective cancer care. We'll see you soon on Pace Hospital's podcast with another informative and awareness driven episode. Until then, take care of your health, stay informed, stay proactive. Thank you for listening.